Yeah. So Dr. Rosenwasser already told you our philosophy, and we are this subspecialty department. So I won't necessarily go through that, but a couple of things, he showed you how big we are, and it's really true. Across our network, we have 45 neurosurgery faculty, 34 neurology faculty, and 30 psychiatry faculty, and neurosciences 15, but it's also growing. So, and our footprint is incredibly large. This is sort of a regional map of Philadelphia. The yellow are where we directly give care, and the red are our affiliate hospitals at this point, and even Jefferson Washington Township down here in New Jersey and Atlantic is part of us. And so we're slowly adding on these sites. Right now, your primary rotation is at Jefferson downtown, which is the home symbol in the middle. We're also having rotations now officially at Abington, and it will be a PGY3 rotation for everybody who joins in the future. But something that Dr. Rosenwasser said that I just want everybody to know, and this is the big part of the culture of our care, the clinical program, and it's about service and commitment. This subspecialty approach it happens because we're incredibly patient focused. The patient comes first. We have to get the patient into the hospital. We don't judge anyone, no matter what insurance class they are or how big or small they are. We take care of everybody like they're our family. So we actually assume and demand that as residents, you also do that. And that's the attitude that we want you to leave us with. Our program, honestly, is very hard program for beginners because there is so much. And I'll talk about that. But it's really the perfect program for the experts or the connoisseurs. If you really think that you want to know every nuance of neurosurgery, we will give you that opportunity, because we really have a really interesting balance between supervision and independence. And that comes from the fact that we're still one of the few institutions that allows us to run 2 rooms consistently, right? So that allows the resident it allows a senior resident to be with the faculty in the harder case, and allows a junior resident to be in the other room with the easier case. So obviously the faculty can't be in both places simultaneously. So it gives you enough independence so you continue to grow. And I think the residents will attest to that. I'm going to speak a little bit more about our education program. Like I said, Chris Farrell is the APD and Michelle is our coordinator. And the way we think about it when we have our meetings, and we have a few committees. We have a program committee and a clinical competency committee, which we meet with representation from all the divisions. And we take a lot of time really to understand what are your strengths, weaknesses, how do we actually bolster it. And so, your education is not one of those things that is an add-on. It's something that we're actually trying to actively be engaged in, make sure you're getting the right mentorship, make sure you're getting the right rotations. And with that, it's a mindset that we've developed inside this program, and the emphasis being on skill set. And so it's something that I really like to get everyone on this call and all our residents to say, why do we do neurosurgery? This is a takeoff from John F. Kennedy when he was giving a speech to this country to motivate them to go to the moon. Why do we have to go to the moon? Not because it's easy, because it's hard. It's our way of saying that neurosurgery is a lot of fun. And that's what we find and define as fun in this program. The other mindset in this program is incredibly important to keep in mind, is about knowledge sharing. There is way too much. I mean, as the residents get senior, they get incredibly great at their skill set, but they also become incredibly aware of everything they still haven't learned, and which is incredible, right? And this, by the way, happens when you're a fellow, and this happens when you're an attending. And you're constantly learning because there's so much nuance to neurosurgery. And so the culture of this program is really to share those nuances constantly. Everybody is learning every single day, and you can't learn every lesson every single day. So you can only do that by community knowledge sharing. So education is paramount. The other thing that I'm incredibly proud about our residents is the culture that's actually been stated now for 7 or 10 years now. We do a lot of things together. The faculty, the staff, we enjoy crazy scenarios. We're writing newsletters to our alumni to keep them engaged. We're going to dinner. We're having black tie events. Although this year we didn't do graduation. Our faculty, Pascal Jabor, Kevin Judy, has the residents over to their houses, and they're connoisseurs in scotch and wine. And so we share all that, and some of the faculty are connoisseurs in cars, and whoever's into that. I mean, so there's a lot. There's book clubs going on. So a lot is going on in our department, and we're proud of that camaraderie between the residents. And really, you're here to learn how to be a neurosurgeon, and I want you to know that Jefferson is that institution. What we're most proud of is that Jefferson is a surgery hospital. We have good medical specialties. We have great surgical specialties. Jefferson has been a surgical hospital since the days of Gross Clinic, Gross Anatomy. Everybody here is familiar with that. People have been coming here for over 200 years to learn surgery. The hospital respects and loves us, and is incredibly supportive of us. So really briefly, I'm going to just take you to a lot of our faculty. Our neurovascular program is incredibly well known, and it started with the philosophy that Dr. Rosenwasser took on probably in 1991 or 1992, when he, as a neurosurgeon, was one of the first one or two people in the world to dual board and dual train. I mean, there was no board at that time, so he created all that and grandfathered into it. And since then, we actually have many dual trained vascular neurosurgeons. So our footprint in this division is absolutely huge. And Pascal Jabor, who we will meet, is the division director. And I have to actually, Staff Jim McCarris is, I think, promoted to professor now as well. So we have 3 professors, and Pascal has an endowed chair. So the division really grows.
And you know what, Ash, we also have Richard Schmidt, who just joined us.
Yeah.
Who's in New Jersey.
That's right.
Yeah.
So we do an incredible volume, and the thing that I'm, from a residency perspective, incredibly proud of is that we still do open vascular surgery. Like every program, the field has gone towards endovascular, but we still do over 150 craniotomies for open vascular, and that I emphasize because it's a dying skill set in programs. The RSC requirements around this have changed, and they're allowing you to couple your aneurysm experience into endovascular. But I don't think, as a neurosurgeon, if you don't have a great skill set in open and endovascular, you're honestly incomplete. So we still have that. I just listed out a bunch of new things, and you can read this, and we'll let this go on the internet afterwards. And I screwed this up because this is the tumor division's accomplishment, so don't even read it right now. But the vascular division does a lot of cool and interesting things. They actually have little endovascular robots. They do intra-arterial chemotherapy delivery. They just did implants for stroke. I mean, they're doing stuff all the time, which is at the edge of the field, and stem cell delivery as well. The second group that I'd like you to really just think about and understand is our spine division. And our spine division is also grown more than you see in this slide. But everybody is fellowship trained in our spine division. Our spine division does over 1,600 cases at the main hospital a year. So you're going to get a huge experience in spine with robotics. Orthopedics is also incredibly active at our hospital. And every once in a while, we'll actually have a resident who will actually really take some lessons and learns. And we've even had residents do research with the orthopedic group as well. Something unique that's actually happened in our spine division recently is, Jim Harrop actually completed a master's in quality improvement, as did I. And he started an incredible research group and database. And this group now meets every Monday and Thursday. In the Zoom era, it's actually easy for everybody to move. So 15, 18 people are moving. The group is probably publishing 20, 25 papers a year because of a lot of quality improvement type projects. So it's a way that entire spine field is drifting. And of course, we're leading it again. Our tumor division is also huge. And on this slide, we also should be adding Mike Lamole now from Abington, because we have an Abington rotation as well, as he's a skull-based trained surgeon. So we basically have 3 skull-based trained surgeons and 2 surgeons who actually also work on malignant GBMs. And we have neuro-oncologists who are part of our group as well. And the brain tumor division, like I said, is also doing a lot of new stuff. We actually have the new Gamma Knife machine. We have the Linac machine. Our guys are writing books. They're hosting cadaver courses. They have tumor and tissue registries as well. So I think anytime a new technology comes, like the exoscope, We have two of them, probably the only center that has two of them. We get all the tools that you need to train and become an excellent master surgeon. Um, like every division at Jefferson, we do an inordinate amount of volume. These guys are doing nearly 1,000 operations a year as well. Functional, we have two faculty, myself and Chen Wu. He actually has a huge imaging lab. We really integrate robotics into everything that we do. We do awake and asleep surgery. We're one of the few programs that probably hit 80 to 100 epilepsy operations a year. Of course, we have the laser technology in every stereotaxy. So every operation is a technology extravaganza at Jefferson as well. But some bird's eye view things that I think are probably as important, if not more important to you, if you don't know which pathway you want to go, is that besides the subspecialization, we're adding community rotations at Abington, and we're still trying to figure that out, but we think it will be a right thing. When people go, our graduates, about 50% of them go into academics and 50% of them go into the community. And so we wanted to really integrate that and show you how both community and academic practices will interact together. Something that you should know about us is we're probably always reaching 5 to 10 years in the future. When there's a change happening in the community, in the cities, I'm gonna talk about this from a big city point of view. We're in a very competitive environment. We actually have a lot of major neurosurgery centers near us, and you guys are aware of them. And you know, we've always been the dominant force in our area, and it's because we're constantly trying to stay ahead and see which way the field is emerging. Everybody in our program now does their chief year in their 6th year, and in the 7th year, you do an enfolded fellowship. Now, everybody may not want to do an enfolded fellowship, and we agreed to that as well. And then we'll create that as a community rotation or a hybrid where you can actually do some things or areas that you might want to refine in. Every resident in their PGY 5-year does research. We work on that almost a year before that execution date, so you actually have a plan and you're up and running and you're working towards a career goal. Jim Harrop is actually working on creating a master's option for quality improvement, so maybe across 6 or 7 years. If you're interested, you can actually get a master's in quality improvement. And I want to emphasize innovation, leadership, and business because it's what we tend to now focus on for the 2021 and 2022. On our own faculty, in the last 3 years, Dr. Rosenwasser, Dr. Heller, and Dr. Judy have gotten their MBAs. And I think it's an important thing. It's hard for you. And I think in the 6th and 7th years, everybody will realize that the healthcare business has also become really complicated. And we want you to leave our program as being a leader and having at least an operational understanding of what that field looks like. And so we're going to start creating a curriculum around that. Of course, the hard part is where do you push in another, another half an hour here. But the most incredible thing is if you take the right person with the right ambition, with the right motivation, the right skill set, you can probably squeeze out 28 hours in a 24-hour day. So anyway, we require people who are truly passionate about what they do. Like I said, we consider ourselves a hard program, but we consider our program that of the connoisseur and the master surgeon. So really look forward to talking and meeting you guys today. Thank you for joining us. Please, reach out to us even after the interview.